Whoops. Sorry for the shaky camera. All right, so I am on here to basically just answer some questions, whatever you're thinking about, and I've got my YouTube open on an iPad actually. Hello from South Africa. Hello, you're in South Africa. Okay, that's great. And I'm trying to find my my comments that I haven't answered. Yorkshire, England. Very nice. So I am doing a little just random questions. I've got my YouTube open on an iPad. I'm doing this on a phone, but I'm going to try to go through and see if there's some questions here that I haven't answered. But let me explain. I put up a video and I said, give me some topics that you guys want me to talk about. And I got a lot of responses for that. And of course, I am going to do good quality teaching type videos, but I thought I might, try to answer some questions on a live today for those. And so I do have one here, and I will definitely be making a video about this topic because this is one of the most unusual entities, in my opinion, in cancer pathology. So this question, it comes from Kirsten, or perhaps it's Kirsten Steuben, and it may well be pronounced Steuben. But if you see this, you can let me know how my pronunciation was. So this question says, my father-in-law once told me that a colleague of his had experienced pain, and when he went to the doctor to have it investigated, they found metastatic melanoma, and they never found the original skin tumor. And then she asks, is that even possible? Well, the short answer is yes, that is possible. And unfortunately, melanoma, and you will hear me as I teach about melanoma over whatever videos you watch of mine. It's a very tricky and a very sneaky tumor. Melanoma can arise in almost any tissue of the body, not just the skin, but in other tissues of the body as well. And it's because you can find pigmented cells, melanocytes, in many different places in the body, strange places like the meninges, within the, surrounding the brain. And good afternoon to everyone coming in. You can find it in the esophagus. You can find it even in the rectum and places like that. So that's the first thing, is that it can arise many different places. The second is that it can metastasize to almost any place in the body. When you go through residency in pathology, metastatic melanoma and primary melanoma is a diagnosis that you see a lot. It's a very common disease. It's a very common cancer. We hope to see them just as stage 1, but very often, especially when you're doing residency at a medical center, you're seeing them at a higher stage because people are coming to the medical center to get treatment for those. So you can see melanoma metastatic pretty much anywhere in the body. I think one time we had one where a person had a metastasis to the gingiva. I mean, think about that. The person comes in with a little nodule on the gingiva, and it turns out it's metastatic melanoma. Well, in this case, the question that was asked was, this person had some pain, and they, apparently they never found a tumor in the skin. So in this case, there's really two options. One is that the melanoma arose within the body in an unusual place that is not common. For instance, like I said, you can see a primary melanoma in the esophagus. I mean, it's a 1 in a million type case, but if you got a melanoma arising in a strange area like that, then when you find it metastatic, it's very hard to tell where it came from. The person may not have a skin tumor. Now, the second and probably most likely answer to this question is that it was an amelanotic melanoma. When you put in medical terminology, when you put at the prefix of a word, it means without. So amelanotic means without melanin. And what that means is it forms a mass on the skin like a mole, except the mole is not pigmented. It looks like your skin, or it'll look kind of pinkish. And so, whoops, sorry. That is probably more likely, is that it is a skin melanoma that is the same color as the skin. Now, this is terrifying. When I was in residency, I used to think about amelanotic melanoma, and it freaked me out, because how many little bumps or things are on your body that you see that could be flesh colored, but it's a melanoma. The answer to that question is it's generally a little more obvious than that. It tends to be pretty well circumscribed. It tends to be kind of a tan pink color, kind of not so much a nodule, but sometimes they're flat, but they're slightly raised. So amelanotic melanoma, you guys can read about that, but I'm gonna do a video on it. And so my guess, in terms of the question that was asked, that's probably what was happening. Now let me go back. So somebody, let's see, Blue says, what is a job you can have while in school to become a forensic pathologist? Something that'll help pay for schooling? Well, I mean, what's a job that you could have? I mean, you can work as an intern in a coroner office. You could work at a funeral home. You can, I think intern in a coroner office is a really good one, actually, or I guess medical examiner office, depending on what state you're in. I think those would be good experiences, because ultimately you want to get experiences with dead bodies, with death, because it is such a strange and uncommon type of medicine to practice. You just want to be, familiarized with that. But really, any job in medicine, I mean, even working as a scribe in the ER, working at a clinic, just anything you can do in medicine is helpful, because forensic pathologist has to know pretty much every single thing that you could know about medicine. So, I would say there's no job that would be like, okay, this is the job you have to have, and then medical admissions committees are going to look at that and say, oh, this person's great. Anything you can do is helpful. Anything you can do in the field is helpful. All right, so have I seen the story of 2 pathologists from Harvard that were selling body parts? I have not seen that, but I'm certain that probably I'm getting tagged and asked to talk about it. I guess I'll make a video about it if I get a little more information on it. So how do you have a primary melanoma in a tissue like the esophagus? Doesn't it have to arise from skin cells? So no, melanoma arises from melanocytes. Melanocytes are most commonly in the skin, but melanocytes can occur in other areas of the body. Melanocytes are pretty common cells. You can have them in the meningeal layers. You can have them, in the rectum. You can have them just inside of the brain itself. You have melanocyte pigmented cells within the retina. So yeah, I mean, that's how it happens. But again, that's a really rare case. I've never personally seen one of those, but it's the kind of thing you read about. How's my week going? Well, pretty good, pretty good. searched the Harvard body scandal, and apparently one of the buyers was the owner of a creepy doll store. Yeah, it's pretty. I just the thought of it is so out there for me, that the tissue, the material that you take out of a body is, it's not yours. It's the property of the facility and the person. So the person, is the body itself is gone. We do have to take samples for testing, and then sometimes those samples are kept. Occasionally, you have to take a full organ. So somebody who has a really unusual heart abnormality, you may take the entire heart, and then the body goes for burial. So yeah, I can see how it happens, because these things are sitting on the shelf. They're either going to get thrown away, because they all get, eventually they get incinerated is what happens. Very few things are kept forever. The one things that are kept, if you have homicide cases, those tissues are kept forever. And the reason why is because that a case may get appealed, it may get turned over, there may be a new trial, 35 years in the future. So you're supposed to keep all the material from a homicide case. Now, I don't know how common it is. I've never been a part of a situation where that came up, where somebody said, hey, should we sell this brain, or should we sell this hand? I've never seen that happen. So I don't know how common it is, but I have seen stories about this before. There was a story, they've had morticians involved sometimes. But the fact that there's a market for body parts that's not being used to transplant is pretty wild. And yeah, some people said I should be wearing a hat or having sunscreen on. And the truth is, I really don't get very much sun at all, ever. I'm very pale, and I never get sun. So this is my way to activate my vitamin D, is if I sit out on the porch and get 15 or 20 or 25 minutes worth of sun, and then that's it. So, but yeah, I do wear a hat a lot, so I don't have to worry too much about that. Let's see what else we got here. Looking at the questions and seeing if I can come across a question. Yeah, it said, so that said they were donated bodies, and so they sold stuff from donated bodies. Well, I don't think it's very ethical. One of the things that's interesting about this is, I one time made a video on TikTok about people who charge money to have an audience come in and watch an autopsy. And I wasn't in favor of it. I felt that it was a little bit crass. It was not what the person, the person had agreed to when they donated their body to science. And I wasn't like rude about it. I just said it's not something that I really think that I would do, unless the person themselves said that I want to be an exhibition to charge for. Well, anyway, the comments on that video, and this was quite a while ago, but the comments on that video were pretty, they were against me. They were saying that they think it's totally fine to take a body that's been donated to science and then just charge money and cart it around for an autopsy. So the point being, there is a market out there that people want this sort of stuff. I'm not one of those people, though. All right, let's see what else we got here. I'm looking for questions here. All right, let me see if there's a question that's come up here. How is the training to be a forensic pathologist? Like, do you start off with a corpse and then when you first start learning? No, you don't. You start with with a whatever person comes in needing a forensic autopsy. I mean, like for instance, my first case as a fellow in forensic pathology was a 5-year-old child that had drowned. So they don't, at least at the program I was at, they don't hold your hand. They start you out. Usually, you won't start on a homicide. That's the only thing I think that is probably universal, is your first case, and probably your first several cases are not going to be homicides. You're going to get used to regular type cases, and get your technique down, because technique is important in pathology, in forensic pathology and autopsy. Technique is extremely important. The handling of evidence is extremely important. So as a result, they usually don't start you out, because when you do a homicide case, one little error can ruin the whole case when it goes to trial. So that's the only thing I would say, is that they start you on pretty much any case, but generally not a homicide. All right, let's see what it says here. If someone's cause of death was a myocardial infarction, will you find traces of tissue that are visibly damaged due to lack of oxygen? Yes, that's how we diagnose it. Myocardial. Let's do medical terminology. Myocardial, of course, means heart, means muscle of the heart, so the heart muscle. And then infarction is a kind of a fancy word meaning tissue death. Okay, so when tissue dies, it looks different. Heart muscle itself, when it dies, well, what happens is there is a predictable array of cells that come in when the heart starts to die from a myocardial infarction. And those cells, when they're viewed without a microscope, have a certain color change. For instance, neutrophils, which are acute inflammatory cells, are some of the first cells that come into a myocardial infarction. Well, neutrophils are also what's in pus. Pus is yellowish green, and therefore myocardial infarctions can sometimes be yellow-green. Well, the heart muscle's red-brown, so it's extremely easy to see. Other times, you'll see what's called a hemorrhagic infarct, where there's actually bleeding into the heart muscle itself. So instead of seeing that pus, that sort of like yellowish green tan color, you'll actually just see blood and like darkening of the heart wall muscle. So yes, that's what we look for with a heart attack. Does your job offer therapy? I would imagine your job is mentally straining. So no, there is no therapy in the job. It's perhaps some facilities offer that, but not anywhere I've ever worked. We did children and babies and homicide, horrible homicide cases and all that stuff when I was in fellowship, and there wasn't one single moment that anyone pulled me to the side and said, "How are you feeling? Did this bother you?" So no, there's absolutely no support for that. Now, would that be a good idea? Yeah, I think that would be a good idea. I think that would be, if I was a director, okay, if I was a director of a forensic pathology program, I think what I might do is I might reach out to the psychiatry department, because most of these forensic pathology programs are part of medical schools, and then every department is there. And then maybe have some psychiatry residents or somebody, or actual psychiatrists, maybe be able to meet with forensic pathology trainees in order to discuss this sort of thing. So that would be a good way for the psychiatrists to train on how to interview and how to assess trauma. And it would be a good thing on the pathology side for us to be able to talk about the things that we saw. Now, I personally was not bothered by any of this stuff when I was in forensic fellowship. I mean, by the time you go to fellowship, you've already been through medical school, you've already been through residency, so you've seen a lot. I mean, you've seen people die, you've done CPR on people that are dying, you've had In pathology residency, you do autopsies on babies a lot because they die in the maternal ward and things like that. So forensic actually wasn't that bad, honestly. Is the yellowish material, is that yellowish material introduced sepsis? No, because sepsis, I mean, when we talk about sepsis, we are talking about, generally people are talking about like septicemia. So not quite the same thing. Sepsis is a physiological condition. Septicemia is an infection. So you don't get sepsis from a heart attack. Now, if you have an infection, like let's say an abscess, and that abscess is filled with pus, it's probably also filled with bacteria. And bacteria will then enter the bloodstream, and then you will end up with a septic condition. Do I have a case that haunts me the most? No, not really. I mean, I've probably got eight to 10 cases that are equally disturbing, but there's not one that that really stands out. I mean, some of them are tragic accidents, and some of them are homicide cases, generally. Semantic question: do pathology residents consider themselves pathologists only once they've completed their program? Yeah, you can't call yourself a pathologist until you have finished residency. And you really, in my opinion, should not call yourself a pathologist until you are board certified in that field. So there are people who finish residency and can't pass their boards. And that's unfortunate, but my view is if you cannot pass the board examination, you are not qualified to practice pathology. That's my belief. So I didn't call myself a pathologist until I took my boards 1 month before the end of my fellowship residency, and then you get the results 1 month after your residency ends. So I didn't consider myself a pathologist until July of 2008 was when I was official board certified in pathology. And I finished residency in June 2008. So how do you determine insulin overdose? I assume it's rare, but still. Yeah, I mean, first of all, with insulin overdose, it's not something it's something we think about. I mean, I think every forensic pathologist thinks about it. But does it make sense in the context of the scenario? For instance, you have to have a death that is, of course, unexpected, and it has to fit, a certain clinical parameter, and then you have to ask, what witnesses were there and what were the witnesses. What does the witness say? Is the witness acting, like, for instance, if it's a husband and a wife? Number one would be, what is the behavior of the people who are surviving? So that can sometimes lead investigators toward that diagnosis. Secondly would be obviously full autopsy. So let's say you've got somebody, you're suspecting it, you do a full autopsy and they don't have any good reason to have died. You have to think about that, especially if they have diabetes or someone in the home has diabetes, because then they will have access to insulin. So that's the first step. Now, from an actual, biological perspective, can you look at a body and tell? You can't look at the body and tell, but what you can do is you can test, if you're thinking about it and you've got the specimens. The difference between recombinant insulin and non-recombinant insulin is that usually there is I think it's called a C-peptide that you can test for. But this is not a standard test. I mean, you would have to suspect this, and then you would have to order that test, and it would be a special type of test. I do think about it on cases where there is some insulin in the home. I think you would be irresponsible not to think about it, but to be able to prove it is a little bit harder from an autopsy perspective. It's, I think, easier from an investigative perspective than it is from an autopsy perspective. Um, but yeah, that's a tricky one. And there was a case recently in the news, which I have not done a video on at TikTok, but I've got it saved in my phone, and I'm going to talk about it eventually. Okay, let's go back here. Have you done an autopsy on a baby that was premature? And was it hard since the baby is small? Yes, of course. I mean, I've done probably 100 of those. I mean, it's one of the most common cases that you do as a autopsy pathologist. In fact, probably 50 to 70% of all my hospital autopsies are premature or stillborn infants. So yes, I do those commonly. And I'll say that, is it difficult? Because everything's smaller? Not exactly. I mean, we're trained to dissect very small areas. Certainly, adult autopsy is easier, but there are things about the fetal autopsy that are easier. For instance, when I do an adult autopsy, opening the head is, I mean, it is difficult to open the head. A very skilled person with a saw and a good scalpel can, from start to finish, can open the head in 5 or 6 minutes, no problem. But it is much more difficult because the skull bone is very thick. Now, with a fetal autopsy, the bones of the skull are not fused. So when you take the brain, I mean, you literally just fold the skull bones open. That's it. So it's that, in that sense, it is easier. But is it harder to come up with the cause of death? I think it probably is more difficult for cause of death with a fetal case, because with the fetal case you also have to consider maternal factors. All right. Do I have a favorite favorite tissue stain on histology? I honestly, it's pretty boring, but I kind of really like to look at trichrome. That's probably my favorite one. Do you think there's such a thing like spontaneous combustion, or is there an anatomical reason for the combustion except materials surrounding? So no, I don't think it's real. Most cases of spontaneous combustion have been proven to be what's called a wick effect, where there is a cigarette or there's a candle or something. The body dies naturally, like let's say they die from a heart attack or COPD exacerbation because they're smoking. And then what happens is that for whatever reason, the tissue will start to burn, and then it does like a wick. It's called the wick effect, and it just burns the rest of the tissue away over a period of time. Just like if you leave an ember in a fire, it'll take a long time to burn out. Well, that's probably what happens with spontaneous, quote, human combustion. How often do you have to recertify? That's every 10 years. Do you see many deaths caused by animals or animal attacks? Tragic shark attack in Egypt recently. Have you autopsied many like this? Well, I certainly haven't done any shark attacks because I live in the Midwest. But animal attacks, yes, we have had dogs kill people. We have had snakes kill people. I think that is it. You know, in Florida, of course, if you do forensics in Florida, you're going to have alligator cases. You're going to have boas. You're going to have probably venomous snakes like coral snakes. You're going to have shark attacks, maybe a jaguar attack if you're lucky. But here, it's mostly dog attacks. And most commonly for me, for my practice, has been a dog attack of a child. And it's always the same type of dog, right? But if you say that type of dog, then you get all the defenders who say that it's a media conspiracy, that that dog is vicious, even though every dog we've ever seen that killed somebody was the same type of dog. So how many people are there in the room with you when you do the autopsies, and is there a camera? So no, there is no there's no video camera. And how many people are in the room? Well, most commonly it's myself, and then there's an assistant Sometimes I do them when I do a fetal case or a infant case, I do it myself. I don't even need an assistant. But when I do coroner cases and big hospital cases that involve like cardiac surgery and stuff, I'll have an assistant. And then if it is a legal case where there's been some criminal element, then it'll usually be myself, it'll be an assistant, it'll be one police officer, it'll be a second police officer that's taking photos. There might be somebody like Child Protective Services there, in addition, if there's a child, representative from the prosecutor's office, sometimes multiple representatives from the prosecutor's office, the coroner themselves. So yeah, on high profile cases, the room is full, completely full of people, which I don't like, by the way. How is productivity measured at your job? Do you need to complete a certain amount of autopsies each day? Nope. I can do, if I feel like it, one autopsy a month, or I can do 60 a month. It's all based on what I feel like doing. I don't answer to anyone except for myself, because I own my own business, and I am an expert that works alone. So in a medical examiner office where they have, like, let's say 8 or 10 medical examiners in the same office, they probably have to do a certain number of cases per month, divided equally among everybody who isn't the chief. A lot of times the chief medical examiner will do less cases, but they are responsible for all of the data and the reports. But I don't have to work unless I really feel like it. And then most recently we have Chloe Clevenger. And it's not alive unless Chloe's here. So I was worried that she wasn't going to show up. I imagine people are eating dinner at this time, at least in the West, because of the time. Not the Western United States, but I'm talking about North America, because it's about 6 o'clock. So it's not a great time to do a live if I want a lot of people here, but I still sort of do them when I have the time. I have to find a little time frame, and I'm trying to get my watch hours up. There's an actual wasp. This is the risk of sitting on the back porch here, is that there's wasps that will dive bomb me. Yeah, so I have to get my watch time up so that the channel can become monetized, and then I can produce more high quality content. And so these lives serve to add to my watch time. So Colette says that she's having pot roast with her son while watching this live. Well, it's probably a good thing I'm not showing images. Let's see here. When dealing with gunshot wounds, do you invite other experts? I don't, because I am the expert. Do you remove endotracheal tubes before opening the chest, or leave it to confirm it was not misplaced? So that's a good question, and I was trained to leave it in place, okay? And the idea that this question is getting at is that an improperly placed endotracheal tube could cause harm to the patient. So we have to make sure that that endotracheal tube is properly placed. But as I moved through practice and I got more experienced, I found that it is not important except in very small amounts of cases. Most cases, that endotracheal tube is put in when they are in the throes of death. Sometimes they don't even have a rhythm, and the tube goes in kind of almost like as a practice for the EMT. So if it's a very big homicide case, or it's something like that where maybe a defense attorney could say and allege that there was improper placement of the endotracheal tube, that sort of thing, I will not touch it. But I have a pretty good sense for which cases are going to be problematic legally and which cases are not. Let's see, 10:55. So you must be in Europe, unless you meant 10:55 a.m. So let's see here. It looks glorious there. Yeah, it is. I mean, it's like 75 degrees and sunny, and you can hear the birds. Maybe it sounds like I'm in a rainforest. Why don't you enjoy all the professionals during high profile cases? Enjoy? I'm not sure what that means. In my country, we only have forensic pathologists and techs who help them. What is the job of the coroner? So in this country, the job of the coroner it is a legal government entity to certify the manner of death, basically. So in other words, I determine the cause of death, I determine the manner of death, but the coroner is the elected politician that will actually put their name on it and say, this is legally what the death certificate is going to say for this patient, for this decedent. So that's the purpose of the coroner here. The coroner is also in charge of property, for instance, and if you look at the history of the term coroner, it goes back to, thousands or at least several hundred years ago when someone used to die, the coroner would go take all the property of the person, and then that would be given to the king. Because as you can see, coroner, the root of that is coron or corona, which means crown. So it meant for the king. And so likewise in my state, if somebody comes in and they've got 3,000 in cash, or they've got earrings and they've got a necklace and they've got a pocket knife or keys, that all goes to the coroner, and the coroner logs all that in and then returns that to the family. So that's kind of what the coroner does. Why don't you all the professionals during the high profile cases like them? I guess you're asking why. I still don't, I'm not, I like them watching. I still don't understand your question. I don't understand your question. You're asking why don't people like for people to be in the room? Is that what you're asking? I mean, when you're in this field, you'll learn that the more people in the room, the more problematic it is legally. And the reason why I say that is because if I'm talking to my assistant and we're dissecting, and I say to my assistant, hey, I think that there's a bullet in the lumbar spine, and I say it to her, that's just for me and her. But somebody else in the room will then say, they'll get on their phone and say, Dr. Wolfe said that there's a bullet in the lumbar spine. Meanwhile, I didn't say that it's there and I'm taking it out. I said, I think that's where it went in. So then that person calls another person, and that person calls another person, and it's problematic. So I really like to minimize the number of people in there, because you have to control the room. That's one thing as a forensic pathologist that you can't be taught. You have to control the room in a way that minimizes damaging effects to the case. Now, I'm very good at that now because I've done it for 8 years. But when I first started, sometimes I would talk to the techs or I would talk to the cops, and I would say, yeah, I think the bullet went in here. I think it came out the ear. And just kind of like talking, because you're talking through things, you're thinking through things. And then you find out that they thought that that was your assessment, and then they went and told people. So you really got to watch it. There are a lot of people watching during high-profile cases. That's correct. But of course, like I said, I don't like that, because it is problematic if you don't control the information properly. If you are just talking out the side of your mouth constantly, and sometimes I like to talk through things when I'm working, I realize that that information can be misleading if used inappropriately. The second thing is I like to be able to move around, and so I don't like tons of people in the room, and I've got sharp instruments, and I've got a saw, and I don't like to have to constantly tell people to move. I like for it to be me, my assistant, and the photographer. That's the best case scenario. But high profile cases, yeah, everyone's there. They feel like they've got a right to be there. Do you ever have to deal with politics, such as trying to persuade you to alter cause of death? So I have had that come up, but it is not common. Like I said, perhaps one case a year, maximum two cases a year, but it's never anything in my personal experience. It's never anything questionable. Like, for instance, it's never a case that is a murder and somebody says don't call that murder, just call it natural. No, that's not what happens. Sometimes it's, we think it's an accident and they would rather it be an undetermined, or we think it's an undetermined and they would rather for it to be an accident. The only time I had to do some pushback on that is, and this is a reasonable case, it's also closed so I can discuss it. But a man decides to kill himself. He's clearly suicidal. And he sends messages to his family which indicate that he's not going to live the night. He goes out and he takes his gun, and he has police, and then the police, I think he's in public. The police surround him because he's got a gun in public, and they want to make sure this guy isn't, going to do anything. Here's this wasp again. Isn't going to do anything dangerous like commit a mass shooting. So they do not shoot this man, but what they do is they just wait for him to do something. Well, finally, the guy decides, instead of shooting himself, he starts shooting at the police officers. And the police officers, of course, fire back. The police officers hit him, and he dies. And in that case, the manner of death is a homicide. It's not a murder, but it is a homicide because someone else shot that person. But because he was suicidal, the police were wanting me to call it a suicide because he deliberately made that action in order to make them shoot. So how did we resolve this? Well, of course I didn't change my opinion, but what I did was I wrote a note explaining why I called it a homicide. And here's why I believe that my answer is correct. Because just because he fired at you, the police officer, doesn't mean you have to kill him. You could have tear gassed him. You could have shot him in the leg. You could have shot him in the, the abdomen or whatever. But instead, it was a headshot. It was a chest shot. It was a deliberate act to kill him. And that in itself was not necessary. So it was not a murder case. It was clearly a suicide. And I think the family was totally okay with that because they know that he was going to kill himself. So that's the kind of stuff you have to do when you're a forensic pathologist. Those are difficult cases. Sometimes people really dig in, they dig their heels in, and they won't change. If I have good information to be persuaded, I will change. But it doesn't happen very often. So I own my own business. How and what was your college major? Well, how is you just start a business. I mean, you just file with the state and you just say, my business is called this, and here's my tax ID number. And then they send you the paperwork, and then you just start. That's it. And then now you're a business entity, and the money you earn doesn't come into your checking account. It comes into your business account, and then you pay yourself out of your business account. So my college major was microbiology. I have no business training at all. In a case where a baby is left in a very hot car, the kid died, parent claims it's an accident, how would you rule the manner of death? So in that case, those cases are very easily accidents if you can show that there was no malice. Again, this wasp is killing me today. If you can show that there's no intent by the parent. So sometimes that might be difficult, but if there's evidence that that parent is, being deliberate in any way in their actions, well, then you can call it a homicide. The tricky part gets where, let's say that happens and the parent is on drugs. Let's say they're half out of it on fentanyl, or maybe they're drunk. Um, their actions were negligent and resulted in death. In that case, you might actually be able to do a homicide. But if it's the standard person hasn't slept for 4 days, they're driving to work, they don't normally drop the kid off, they forget because it's not part of their normal routine, and the kid dies, that is pretty safely an accident. Um, Amazingly, I have never had one of those cases. I have had pretty much one of everything, but I've never had one of those. Does forensic pathology run in your family, or are you the first? No, there are no physicians in my family. There are no PhDs in my family. There are no college graduates in my family. Um, I am the only person who went to medical school, or who went to college, went to medical school, did a residency, did a fellowship in forensics. So, yeah, it's pretty unusual, especially when you consider that I'm from a very small town. I'm from a town of about 3,000 people in southern Indiana. Um, but yeah, that's what I end up choosing. So, um, it's been an interesting career, but I also am a surgical pathologist. So, I'm board certified to do surgical and clinical pathology as well. So microbiology and hematology and stuff until 2027. So it's until 2027, and then I can recertify or choose not to recertify at that point. And then I'm board certified in forensics until 2028. So we'll see. Probably be retired by then, I would say. All right, let's do like one more question because I've been on here for 45 minutes. I think starting next week, I'll be able to schedule the lives. So you know what would be helpful is because I have regulars that come into these lives, right? I would be interested to know what times are the best for you to watch lives. Now, I can't cater to everyone, of course, but I would just be curious. So when this live posts after I'm done here, I mean, if you could just write in the comment the times, you might even write kind of where you are, because I know there are people in Europe that watch. There are people, obviously, we have South Africa here watching. Most of my viewers are the United States, but I would be interested. I might even do a thing where I do one more for the US and one more for, Europe and Asia. Most exciting diagnosis you've made? I mean, look, I have been in this field since 2004, and I have made diagnoses is the plural of diagnosis, that have been extremely exciting. I can't even begin to tell you the number of cool things that I have found myself that have resulted in solving the case. In fact, I will say this. Unfortunately, it's not going to be very helpful for your question. One of the best cases and one of the most exciting diagnoses I made last week on a case, and I signed the case out, and I'm pretty sure the doctors probably haven't even seen the case yet because it was a medical case. The doctors have not seen that case yet, and therefore the family has not been told, because I don't directly tell the family. So unfortunately, I can't really talk about it, but I will be making videos in the future about that case. It is definitely the case of the year for me. And in fact, I've done approximately 3,000 autopsies, and it is the only time I have ever made the diagnosis. I will say that it involves a cancer, and it is stunning. It stunned me. And when I found it, when I did it, and the cool thing was, the doctors, sometimes they know kind of where the diagnosis is going for their case. They feel that they can predict, oh, well, this might be a pulmonary embolism, this might be a cerebral aneurysm, something like that. But in this case, they completely had absolutely no clue that this was going to be what I was going to tell them. And even I, when I saw it, I'm not sure I've ever seen a case or heard of a case like it. So, unfortunately, I can't really talk about it because the family hasn't been told yet. And then last question here. Will you scan or x-ray a body prior to an autopsy to see where projectiles are lodged? Yes, of course. If somebody is shot, we have to do it. We have to do x-rays because if you're lucky, you can get a CT scan, but I'm not so lucky, so we have to do x-rays. Bullets can lodge in very difficult positions in the body. The ability to look at x-rays and go in and get that bullet, that is the true stuff of experts. And I am very good at it now. And when I first started, I was pretty good at it. But you have to do hundreds, in my opinion, hundreds of cases of gunshot wounds and stab wounds in order to become really good at that. That is something that experience, you can't learn it just in your fellowship. You can't learn it from teaching. It is purely experience. And so I do feel happy that I've gotten to that level. At this point, I don't really feel like I could get any better at it, which is kind of cool. But yeah, we do that, and thankfully, I'm not seeing a lot of that recently. I'm not seeing a lot of gunshot wounds. But anyway, thank you for all your questions. And somebody mentioned I got my dose of vitamin D. I probably did get overdosed here, sitting in the sun, but I feel good, and I'm gonna feel energetic later because I got my vitamin D converted over in my skin. So we should do a video on that, talking about the vitamin D pathway. It's like basic human physiology, you know. All right then. Well, thanks for everything, and I will see you again. I am going to be doing a fair amount of lives because I'm really wanting to get the channel monetized by the end of June. That's my goal, because then I'm going to take a little time off, and then I'm going to come back with some actual like good content. I mean, I guess the lives are good content, but I'm not really showing you any pictures. So Lucky was here for the first live, and she or he enjoyed it. So I would say, please come back. You can click that bell on my page, that little notification bell. And if I go live, it should notify you. If I make a video, it should notify you. Okay? And then for anybody else watching this out of sequence who doesn't normally follow me, my TikTok is called The Dead Letter. My Instagram is called The Dead Letter, and you can subscribe there if you want for some interesting little case studies and things like that I do. And then, of course, the YouTube and the podcast are Knife After Death. So thanks again. I was here a lot longer than I thought I was going to be, but it was fun. Thank you.